Good evening, everyone, and welcome to the second webinar of our series, Building Impactful Careers in Global Health. My name is Mignon Omurerwa. For the people who were not able to join the first session, I am a student at USA University. I'm doing master's degree program in global health security. Welcome everyone. And last week, for people who were able to join, I really hope you enjoyed. We celebrated global health talents. We got a very big opportunity to learn from them and their journeys. And for people who are not able to join the first session, please check it out on YouTube. The whole recorded session is uploaded on YouTube already. And then I'm really sure you gain a lot from it. So, welcome. And today, we're going to dive in our second webinar, now with an interesting and deeper question: how to align our careers with the real needs of the world. We have big minds speaking to us today. And, we know global health is a very big field. It is broad, but the challenges are many. And often the impact begins with choosing what your focus really is. Therefore, tonight we're going to explore 5 major global health challenges. And we're hearing today from Dr. Eric. He's going to have a whole presentation about these challenges. And after that, we're going to hear directly from the professionals who have aligned their work with these needs, and they're going to talk to us specifically on the challenges they're working on. And we move throughout the session discussing with the panelists plus the presenter about these challenges. A kind reminder, please, as you follow this session, remember to send your questions in the chat, and we will address them during the questions and answers segment after the presentations from the presenter and our panelists today. So, ladies and gentlemen, allow me to present to you today's presenter, Dr. Eric Niyitanga. He is my co-host, but he's gonna let me introduce him. And he is a genius. Personally, I call him a genius. But professionally, he is a medical doctor and a global health professional. Currently working as a researcher at University of Global Health Equity with a very progressive experience in clinical care and health research. A very good note is that Eric received an Academic Excellence Award in the Masters in Global Health Delivery program at the University of Global Health Equity. He is a very good leader. He's the founder of Weya Health, which is hosting this webinar series. And he is also an author, contributed to New Times as an auditor, and he has spoken to different global stages, including TEDx. He is very passionate about strengthening health systems through research, capacity building, innovation, and strategic leadership. Dr. Eric Niyitanga, over to you. Welcome, and we're so ready to hear from you today.
Yeah, thanks, Miggy. I don't know if we are going to make people wait for so long. It wouldn't be a good idea for people to know other speakers we have today, because my presentation won't be long.
Really? All right. Yes, I can do that.
Confirm they're there.
They're here already?
Yeah.
They're not here yet, but I will also introduce them, and then we dive in the presentation and then go ahead with panel discussion. All right? So tonight we have Viviane Vivian, are you there?
Yeah, I think she's on the call.
I think I'm here. Why should I introduce myself before Emil? Aren't you going to beat me?
Ladies first, and we're getting ready for International Women's Day a few days ahead.
You got it very right. Ready, set, ready.
Yeah, it's good to see you. I hope when we come to after this quick presentation, you get to talk more about them, right?
Sure.
Yeah, I will. It's a pleasure to join in today, and thank you everyone for coming. Allow me to share my slides quickly. It's gonna be 10 minutes. Okay, here we go. Can I confirm someone sees my slides?
No. Okay.
I do.
Okay.
You see them now?
Yes, I can.
All right. So I have 10 quick slides talking about these 5 global health challenges and aligning your work with the need. So this is part of 5 webinars we are hosting, trying to explore how you can build an impactful career in global health. So last time we had just an overview of what global health is through learning from graduates from UGHE and what the work they're doing. So today we look at actually 5 major global health challenges and how you can align yourself depending on what you want in the field you want. So it's good to actually have, because there are so many problems in the world on health, that you choose what you work on. And then I'm really glad to be joined by Emil and Vivian from different institutions who are going to share with us actually what they're doing and which problem, which issue they are focusing on and why and how they came about that. Then after this, during next week, we look into actually 4 career pathways you can go through. You can contribute to all those 5 programs in one of those 4 career pathways. Don't miss. Then after that, we see how you actually position yourself as an individual or as an organization to get opportunities, attract opportunities in this space, depending on the pathway you take, depending on the problem you choose to work on. And lastly, we look at actually when you're now into maybe if you're looking for a job in global health, how to ace your next interview. So this is the whole structure, and that's why today I'm excited to talk about 5 global health issues. These are just, if you want to think about global health, think about these 5 things. It'll give you just an overview and it will help you to see where is my passion and how can I contribute to this one. It's because if you were trying to do everything, you end up doing nothing. So like the other John who tried everything but mastered nothing. So it's important to really understand the whole space, the problems you are facing in global health, and align yourself with them and what you want to do with your work. So there are 5. So the global health is really focused on these 5 issues. 1, it's around nutrition, child and maternal health. This is actually an unfinished agenda because in 2002, the Millennium Development Goals focus on this, but it was not complete until even as SDGs. There are something around maternal health. So field number 1 is nutrition, child and maternal health. Field number 2 would be look at the rising non-communicable disease challenge. Number 3, the global health looks at infectious diseases and antimicrobial threats, antimicrobial resistance. So this is infectious disease, non-communicable disease, nutrition, child and maternal health issues. Then there are issues around health systems. We look at that. I will give you just an overview. And lastly, another aspects field. Really, one of the issues is inadequate public goods for health. This includes vaccines, medicine, and diagnostics. Starting with children, the problem is all around children who are dying. Close like in 2023, 4.8 million children died under 5. and from really issues like malnutrition and infectious disease like pneumonia. And one of the determinants of whether the child survives or dies is whether they are breastfed, they get vaccines, if they have diarrhea, they get oral hydration, fluids, and zinc. All these are the things which actually influence whether the child survives or not. And Africa, Sub-Saharan Africa, and Asia, South Asia, they suffer more because of poverty and weak health systems in those countries. And there are some global efforts led by WHO around encouraging exclusive breastfeeding until 6 months, focusing on skilled birth attendants to prevent newborn mortalities, vaccine immunization, and preventing malaria, especially in endemic zones, encouraging mothers that the baby should sleep underneath. So if you think about global health, this area you can focus on. Maybe children, how to make children survive more. It's one of the burden the world has, and you can choose to work on that. Next, it goes with also mothers around children and mothers, they go together. We really, the world is still struggling with mothers who die during labor. Close to 260,000 died in 2023 from just child labor. It's a large number. And one of the major causes of mothers who die during labor is bleeding, postpartum hemorrhages. Other condition, hypertensive condition of pregnancy, abortions, and other complication, with maternal death. So this is another major challenge, and there are a lot of problems around that. But the world has been trying to address this through, especially strengthening antenatal care, mothers consulting ahead of delivery so they can get services and their delivery is planned, but also strengthening the maternal health services, especially in rural communities. This is another problem, maternal mortalities, maternal challenges. So besides nutrition, because nutrition is understanding children who are malnourished, all that, and maternal and children. Another global challenge is around now the rising burden of non-communicable disease, where they contribute actually 75% of death these days. These are diseases like cancer, diabetes, cardiovascular disease like hypertension, which actually the leading cause of mortalities, stroke. NCDs is a growing burden. Actually, in fact, much of my work in research focus on non-communicable diseases. And this burden is heavier in low and middle income countries where all the premature deaths happen, like 83% of them happen in poor countries. So it's expected to rise to 75.5 million by 2050 as population age, lifestyle change, people living in cities, all these issues. So, and increasing risk, sedentary lifestyle, alcohol, smoking. So there's a burden on NCDs. So you can choose to focus your career working on non-communicable diseases. You can pick one. So as we'll see next week in the pathways, career pathways, but global burden of NCDs. Following NCDs is infectious diseases and antimicrobial resistance. HIV, TB, malaria, they're still problematic in the world. And there are some global efforts that you can choose to focus your work on infectious diseases like that one. And with this comes with antimicrobial resistance. Antimicrobial resistance, as these pathogens, bacteria, viruses, actually they become resistant, strong enough to resist the current medications, antibiotics and all that. And this is a really big problem because if it continues, we lose the capacity to treat infections we used to treat in the past. So it's a problem, and it's driven by mostly overuse and misuse, because your abuse of antibiotics and other antimicrobials teaches pathogens actually how to fight, to remain strong against those antibiotics. They give you treatment for, let's say, a cough, and you don't finish the prescription. And the bacteria are not fully eliminated. The remaining ones actually now they're stronger. They know that drug. So in the future they won't help you. So this is really a major challenge, and there are a lot of global efforts around dealing with antimicrobial resistance, because without antibiotics, pathogens we can't manage. So it's really a major threat. Infectious diseases, including pandemics. If you live in this time, COVID, how it came. So it's important to think that another challenge in global health is infections, pandemics, of course, antimicrobial resistance. So you can focus your work around that in global health. Second to last is health system fragility or weak health system. So when we talk about health system, we are talking about 6 building blocks which make health system work. One is access to services, then health workforce, we have information, data and technology, then we have governance, leadership, have financing, and then we have essential medicines. People. So those 6 things, that if any one of them is not strong enough, it's not available, people won't access service. If you have doctors but they don't have medications, it won't help. If you have all those medication doctors but you don't have hospitals, you don't have beds. So all those blocks are also one of the challenges in the world in a global health. So one of the work in a global health is strengthening health systems, including either work on those 6 building blocks. As I mentioned, health workforce, nurses, doctors, midwives, lab tech, then services, making sure people can have access, financing, insurance, people able to access without suffering, then infrastructures, then medications, government's leadership. Do we have coordination of work? So all those things. So there are challenges in workforce. Really, like by 2030, we have like 1 million deficit in the workforce. Funding of all those things we mentioned, it's one of the problems. So some organizations, some individuals focus on actually the work that strengthen health systems. Let's talk about universities, for example, which are training health professionals. The last one now is public goods for health. This is around, there is really a gap in research and development of vaccines and diagnostics. For us to have treatment for malaria, there's a research done around that medication to prove that it works or it doesn't. Diagnostics, how do we find out if there is a COVID? How do we know if someone has COVID or not? So there's always an ongoing need for those public goods for health. And some organizations, some individuals choose to work on those ones. So one of the issues in that is underfunding for research, especially for rare diseases. There's also economic contribution of research around that, ethics in equitable access. All these are the issues you can look at when you think about global health. So these are the 5 major global health challenges. If you think about the word global health, really you see every global health problem you see, we usually fit in one of those. Nutrition and child and maternal health, also with the reproductive health, of course. When we talk about maternal health, we just classify them together. We look at NCDs, the rising burden of non-communicable disease, increasing infectious diseases, pandemics, and antimicrobial resistance. Then health system, are they strong, are they weak? Like, do we have a streamlined systems on how care is delivered, how people get what they need? And then, do people actually have access to medication, vaccines, and the diagnostics they need? So, this is all. Which problems do you really care about among all this? Or which problem does your organization work on? You can write a comment in the chat. We really love to see that, the work you're passionate about, and what your organization is doing. Thank you very much. We can now go into discussion with our panelists. Thank you very much.
Thank you so much, Dr. Eric. That was very insightful and also shocking. Seriously, I didn't know that of all the deaths 75% of those are caused by NCDs. Shocking but also concerning, right? So thank you so much, Dr. Eric, for taking us through that insightful presentation. Now allow me to acquire our panelists who are going to take us deeply into these challenges. And as I promised, I'm going to present to you the big minds we have today. And I insist I begin with Viviane. As I said, we're getting ready for International Ladies Women's Day. So today we have Viviane Umuhire Niyonkuru, who is serving at Rwanda's Ministry of Health as Skills and Career Path Analyst. She also leads efforts to strengthen research capacity, digital learning, and continuous professional development for healthcare providers. She's a research fellow at Rwanda Biomedical Center and a training facilitator at African Field Epidemiology Network, where she mentors emerging epidemiologists and supports scientific publication. Viviane, welcome. We're really glad to have you today on the panel.
Thank you very much. Yes, David. Hello.
Hi, welcome.
Thank you. Welcome.
Yes, we also have Dr. Emile Ngabo. He is an operations director at Oasis Health. He is a physician and a clinical researcher specializing in epidemiology and disease control, and he's currently focusing on antimicrobial resistance. Sounds familiar and interesting because we just talked about this a few seconds ago. And as operations director at Oasis Health, which is a non-governmental organization in Rwanda dedicated to combating antimicrobial resistance, he led an antimicrobial stewardship program training healthcare providers across Africa and heading AMR awareness campaigns, workshops, and youth competitions. Dr. Emile, we're so honored to have you here on the panel. And if you're around, kindly wave and say hi to us.
Hello. Just pleased to be together with you today.
Thank you. Thank you so much, Dr. Emile. So,
thank you.
After Dr. Eric grounding us into these 5 important priorities of global health, we want now to move from the global lens and now go to personal and organizational lens. We want to learn how the professionals choose where to engage. We've seen 5 important challenges and how there are big burdens to healthcare today. So we really want to learn today, how do organizations or people decide what to prioritize in global health? So I'll begin with Dr. Emile, and really want to know, among these 5 global health challenges, which one mostly align with your work or your organization, and why do you think this is the most urgent area today? You take us through that, and then after you, we'll have Viviane next. Thank you.
Okay, thank you, Mignon. I thought as we go with ladies first, I thought we should be beginning with Viviane. And then you are mixing, but it's okay. After you've brought about the issue of going with ladies first, I just jumped in the inbox of Viviane and I was teasing her. So why shouldn't I start? It was all about joking and laughing along it. So thank you very much. So as you say, I'm Emile Ngabo, and I just work as the operations director of Oasis Health. So the reason why I'm just coming back to this is because it's the center of the question that you actually asked me. So what is the global health challenge that I'm currently working on. So Eric said different global health challenges, maternal and child health, NCDs, infectious diseases, and even the other different challenges. But specifically for me, the global health challenge that I'm working on is antimicrobial resistance. And once we say antimicrobial resistance, majority of the people might not understand it unless they are in the healthcare field or unless they heard it somewhere. But hearing it somewhere might not also be enough, maybe unless they might have been trained a bit on it. Because it's something which sounds weird and it's not a common topic. And everyone is saying non-communicable diseases. Majority of the campaigns are around it. The other people are talking about they're talking about sexual transmitted infections. Everyone knows HIV. Everyone knows different STDs. But once we say antimicrobial resistance, sometimes sounds weird, and people might not happen to understand what it is. So I do focus on antimicrobial resistance, which is the phenomenon whereby bugs or disease-causing germs develop resistance against medication that's used to treat them. And if I say antimicrobial resistance, you immediately understand that it's infectious diseases. So therefore, I'm working on those germs or those pathogens that has created resistance against medication that's used to treat them. Therefore, after they've created resistance, the meds cannot treat them. Maybe afterwards they die. Maybe they don't die, but they stay longer in the hospitals. And if they stay longer in the hospitals, the hospital bills will be going high. And maybe if the hospital bills goes high, they might be put into poverty. So some kids were used to go to school. They were used to go to very good schools at home, but they might not be able to go to school again due to the resistant bug. So that is the antimicrobial resistance. So if I say antimicrobial resistance, so it is not just the resistance of the bugs, but it is something which goes far beyond the bugs being resistant, but it also affects even the economy of the people who are concerned. So if we talk about some of the numbers about antimicrobial resistance, so majority of the people doesn't know that it kills many people than breast cancer do. It kills a lot of people than HIV is doing currently, and antimicrobial resistance kills a lot of people than cancer is doing currently. So we understand that how antimicrobial resistance is something which is not simple in terms of the numbers. So back in 2019, it killed around 1.9 million annually. So, and is projected to be to kill around 10 million in 2050. And once we say about the economy, the antimicrobial resistance is projected to will drop the economy of the world in terms of GDP by 3.5. So it is something. Some people used to say it is a silent pandemic. The COVID was a pandemic which everyone knew. Marburg was a threat, and everyone was aware of it. But antimicrobial resistance is taking the lives of people, and none is talking about it. And antimicrobial resistance is jeopardizing the individual household economy, and none is talking about it. Antimicrobial resistance is dropping the global GDP, and none is talking about it. So that's why antimicrobial resistance is something serious. It needs to be discussed. People need to be aware of it. So then, antimicrobial resistance, we should shout about it. That's the issue that I'm working around. So if you just try to understand the area which I'm working in, so it is infectious disease, it is antimicrobial resistance, and how do I work around it? I just walk around it through Oasis Health, which is a local organization, which is a local NGO that I founded. So if I said the operation director, I'm also the founder of it. So antimicrobial resistance, I'm working around it, even in LISAT, because I'm also the investigator of new drugs and new vaccines as a researcher. So if I say antimicrobial resistance, understand it in that area, understand it in that way, and understand the way it is. It is not just a simple issue, but it's something strong, it's something great, it's something that is threatening the world to undo decades of progress that have been made. You know, we used to not to have treatment of majority of the infections, but in the Second World War, they came to discover antibiotics. However, recently, majority of the antibiotics has been resistant, and they are no longer giving the outcome they were supposed to be. So many diseases are killing people not because the medication has not been discovered, but because the medication has been discovered, but they are no longer working. And the issue is this: the progress, the time to take to develop one antibiotic. So it is very, very, very long period, around 10 to 20 years, while the time to take for a bug to create resistance can be 2 years against that medication. So the speed on which the germs are creating resistance is something which is kind of rapid than the speed we humans have to develop the counteractive mechanism, or the mechanism to defend ourselves from the threat. So thank you very much. I might have said a lot about the field which I'm working in with, which is antimicrobial resistance and infectious diseases. So thank you very much. Maybe follow-up questions will be received.
Thank you so much, Dr. Emil, for that insightful point of antimicrobial resistance and explaining deeply why you think you went for this challenge over all other challenges we had. Thank you so much. Now I'll bring in Viviane so we can hear our journey as well.
Thank you, Murerwa. I'm very keen to talk about first antimicrobial resistance, because if I remember well, after the Second World War, the penicillin was discovered by Alexander Fleming. If I remember well from what we used to run in biology or some other courses. And the reason I'm very interested to start by antimicrobial resistance, the fact that at my master's level, I did my thesis on antimicrobial resistance, and I was doing much of the lab work, testing some antibiotics, and for those who know antibiotic susceptibility test, it's something that takes time, but it's real. It's something that is happening out here in my study as One Health enthusiast, and it was cross-cutting from the animal. I took a sample from cattle and also to the human. And there was crossover from animal to human to animal. That's where biosecurity comes in as prevention measure to prevent antimicrobial, antibiotic, anti-malaria resistance. There are many resistance, we can talk about it, anti-parasitic resistance. So how does it connect with what I do and what I'm doing at the Ministry of Health? It is, you can imagine what we do at the Ministry of Health in the way of developing healthcare providers, increasing the number and the quantity. It's cross-cutting among all those 5 main challenges Dr. Elik discussed before, because whatever you can do, you need people. What people do you need? WHO estimated that at least we are supposed to have 4.4 or 44 or 45 when you round healthcare provider per 10,000. No, most of the time you will see it per per 1,000 means that it's now going to be a decimal, even if we know that no one is a decimal, no person is a decimal. And Rwanda stands at 1.1 by 2023, before we started the work we are doing. Most of you have heard about 4x4. The 4x4 comes in as an initiative to bridge the gap for us, at least, to have the healthcare providers based on WHO recommendation, but not only for WHO recommendation, but also to respond to our need. The need to healthcare, the need to specialize the healthcare. As you have seen, Rwandans are being civilized. They are now coming to the hospital. And if they have skin problem, they know that they need a dermatologist. You cannot give them a GP or someone else. They be like, specifically, I need a dermatologist. Sometimes they mention names because we have few. What we are doing is trying to increase the number of frontliners. When we talk about frontliners, are GP, nurses, midwives, pharmacists, and others. But also increasing the number of specialized care. We have tried, if you have seen the report of a midterm of 4x4, which is now 2 years down since they started, we have tried to increase number of specialization for doctors, where we added one more resident. And for subspecialization, we added more than 17. What we call fellowship, for those who knows how to classify specialization for doctors. Our ultimate goal is not to increase the number or to have a fancy name as like someone who is specialized, who is subspecialized in pediatric anesthesiology. That's a subspecialty. What we aim is to have that care that is responding to the need. If the demand is changing, if the disease are emerging, what are we doing to respond to infectious disease? Now we have infectious disease fellowship program for doctors to be ready to proactively and even reactively respond to the emerging diseases like the one we have seen, like Marburg, COVID-19, and others that are still coming. And also, not only that, to get ready to serve the primary health care, where we aim at least to have 95% of treatment or clinical care to be provided at primary health care level. So for us to do that, we invest in teaching, in making sure that people go to health related faculty, but not only doing that, to also get there with information. We used to go blindly. I know Emir became a doctor because it was like, if you did MCB, if you did PCB, you have to be a doctor. It's not a mandatory. It's not. How do we help you to choose the pharmacy? How do we help you to be a dental surgeon and other profession you can imagine? And that's where Vivian stands, to identify the skills the country is missing, and also to orient people on their career from when they start undergraduate, before they choose, and also when they are going for specialization. And also adding the fact that I have to make sure that I collaborate with universities from abroad, hospitals, to ensure that what we are missing here, we are getting it, to get the top-notch experience, the expertise and equipment. Of course, all of that, it's a very big spectrum, but we try all our best to make it happen. That's what we do at the Ministry of Health under the Health Workforce Development Department. And I mentioned about a bit on my role. If I can stop by here, I know that there is many more questions people they want to ask, and maybe even the moderators still have few. In a brief, in a nutshell, that's what we do.
Thank you so much, Viviane. That was so informative and insightful. And thank you so much for bringing in a new concept, if I may say. We've been talking about challenges, but Viviane talked about human resource. If we're talking about impact, skills that are going to align with world's needs. Viviane is so concerned about those skills and people who are there to make sure they bring positive changes in global health and also act on these challenges that we're talking about in the field of global health. Audience, hello. I need to see you around here. I need to see your questions popping.
I have seen Elik. Elik is, I don't know to read the other name. Elik S. I have seen you. Where are you?
Yeah, actually, I think we still have a luxury of time. We can even open for, the audience who want to say something. But Viviane, thank you so much for sharing that. I think you're doing an amazing work regarding health system strengthening. I remember I met Viviane one day. I was trying to figure out my next move in my career. And the conversation we had was amazing, was helpful. It has resulted in my work today, which is around research and policy. So Viviane, thank you so much.
You're most welcome. While the audience is still thinking about the question to ask, I see someone called Ishimwe Elik appreciating the presentation. That was like to make you all curious. If you want to come to us anytime, we can have a separate call. But you can ask yourself, how did I transition from One Health to health system strengthening? If I can talk about that, in a minute, it's not deviation. From the start, I was thinking that I'm going to work on zoonotic diseases, antimicrobial resistance, as the one I worked on my master's practicum. But when you start doing your work, this is the thing you have to focus on. Sometimes you have to think about what season are you in. Am I in a season of running, academic-wise? Am I in a season of transitioning? Am I in a season of accumulating some career experience? Because every season in your life matters. And then if you identify the season you are in, that's where you know how to invest your effort. As I joined that, I was kind of not seeing the way my knowledge, what I did at the school, is going to work, really connecting what I'm doing. But I realized that whatever I was thinking about, I need people. I need a very pool of people who can react on infectious disease, if I can quote. I need people who can react on maternal and child health. If I always complain about maternal mortality and any other trait you can think, I realized that was the real time for me to get to know what is needed and how can I help the country and helping myself to fulfill my dream. Because my dream was to see people happy. If you have at the University of Global Health Equity, where I did my master's, there is a lecturer who always asks students, are you happy? And you have to be happy in any case. Yeah. He always say, if I can quote him, situation can be worse, even worse. Remember to be happy. So, for seeing people being happy for me is to see mothers are being attended with skilled labor, antimicrobial resistance, to have people in the laboratory who can even test that, who can understand how it is affecting the country and the world in general, who can respond to zoonotic diseases, and also to know when to shift from one thing to another. So, to be brief, you have to see and judge what season are you in to know the career to take. Emil, is it that true? Okay.
Yes, Viviane. That was very, very, very insightful. Actually, there is something which we need to think of. There is a need and a passion. So once you do not connect the need which the community has and the passion and even the current situation, the current scenarios. So nothing's gonna go through. So you might be too much enthusiastic to follow your passion. But if you follow your passion without taking care of the need or the pressing need that is currently present on ground, the result might not be good. And if you follow the need without considering the passion as well, so you might end up finding yourself not enjoying what you are doing. So that was critically impressive, and that was a very good practical experience. So thank you very much, Vivian, for that great insight that you brought to me.
Great.
Oh,
Very insightful. Thank you. I'm loving this very much. Do we have a question in the chat box? Eric Shimge, thanks for the good presentation. Thanks for good initiative for 4x4 Ministry of Health. What are strategies that you are planning to use in order to prevent turnover in health institutions in our country?
Wow. Eric, isn't it wow? This question is coming from genius person, because if you don't think about that, you will be like fetching water in a bucket. That bucket yo mu cyaro andi bavuga in Kinyarwanda ngo uri kuvomera mu kiva. As someone who love what I do, for me to understand what we can do as government, I took a very good move to start understanding why people live. Where do they go? For me to have what I can call transitioning research into policy, into implementation of interventions we recommend, which Eric mentioned early on. And from that study, which already completed in February this year, we get to know where people go and the reason they are living. So it is equally important for the Ministry of Health to train, to increase the number, but also to retain. Retaining is not putting people in a prison. That's not how it works. If you put them in a prison, they're not safe. What we are trying to do is to make sure that we work on the recommendation they mentioned and even what we think that can work for them so that they can be retained and they are happy to serve. That's what we are doing. And as well, in a few months, you will see some of the results like published and also being implemented. The publication is one thing, but the very bad thing I heard from some researchers, they publish, they recommend the government, they recommend the country, they recommend the NGO, but they don't get to come back and also monitor at least if what they recommended is being implemented. Like having 1,000 publication without anything like impacting the health of community, you are wasting time being principal investigator, first author, which I don't know where you are going to use it later on if it's not impacting the health of the community. Yeah.
True. Thank you so much, Vivian. And let's look at Simeo's question as well. He asked, if our generation is expected to lead the future, how can we challenge the environments that are quietly shaping unhealthy habits among us? For example, an increase in processed food, etc. I think he didn't specify.
Can you come for this? I guess you are youth. You are young, right?
Anyways, this question aligns much with my work, actually. I didn't go in details with what I do. In those 5 challenges, I can say much of my work is in non-communicable diseases, maybe, and health system at one side, especially on the research side, recommending on a policy, which we'll see next week, how you can choose actually a path in whatever field you are. So you asked about, if you are to lead the future, what can we be doing, especially on the environment and habits? You gave an example of processed food. If you look at non-communicable disease risk factors, one of them is all these food people eat, processed foods, tobacco, alcohol, sedentary lifestyle. And WHO has recommended something called best buys. Best buys, these are the recommendation of policies actually the government can put in place and reduce the consumption of those unhealthy commodities. So some of the recommendations include taxation on tobacco, high taxes on tobacco, then hopefully they become more expensive and less consumption. There is education around salt restriction. There is education on processed food and the restriction and the guidelines. So really, this is so much of a policy work because industries are doing that. The advertisement and doing much of that to make people consume more of that. So as leaders, the first responsibility is do the work at the policy level, put in place policies which actually which are favorable to make people behave better, but also increase on the educational side of the thing, because behavior of humans is a very complex thing, I should admit.
I need to comment a bit.
Yes, Viv.
The reason I want to comment, Elik tried to talk about the policy side of the question, but I want to come a bit on individual contribution. The government of Rwanda, for instance, have tried many initiatives, including Car-Free Day, for people to gather together and exercise. There is a policy for stairs in each building, in towers, so that people can use stairs instead of lift. There is a policy for having the pedestrian space on every road constructed. There is green carpet. I'm talking about exercising. We have green carpet at Nyarutarama, we have it at Primatil, we have sport facilities, many sport facilities, gym and security. You can learn anytime you want. The reason I'm trying to mention this is not for us as young people to put it to the government, to put it to WHO, to CDC or FDA or any other agency. It's our law to entertain and enjoy what the government put in place. For those who always see my status, I always sometimes tease around and people be like, why Vivian is like that? Why can't you even go to Nyandungu Eco Park? Why can't you go? It's free of charge, most of them. Why can't you go to the green carpet? It's very fancy. You can take a picture, you can walk, you can learn, you can jog. That's a choice. It's an individual choice. The government did what was supposed to be done. The second one is on healthy diet. When I talk about healthy diet, I remember when I was having conversation with someone in 2021, and he mentioned that NCDs, non-communicable diseases, are like HIV. What he wanted to mention is not to say that NCDs are contagious or are infectious. They are not. What he wanted to say is that NCDs and HIV takes the good part of our life. To get NCDs, you are enjoying pizza or every day, burger, you are sleeping 10 hours without exercising, you are drinking beer as if you are going to die tomorrow. You are like enjoying life. The same to HIV. I don't want to talk about HIV, but you know how HIV comes in our life. So it's your choice to make sure that if you, it's kind of harsh truth, but I have to talk about it. I guess you will not be offensive. It's our
Yeah.
Yeah.
What?
I think we lost her, but yeah, she was making really interesting idea points.
Very good point. Yeah.
As Vivian is not communicating now, let me jump in. So the fellow of ours in the chat introduced us to the point of those unhealthy habits, unhealthy foods. So, something interesting, you know, NCDs NCDs or non-communicable diseases are actually the leading cause of mortality in Rwanda. And something interestingly, if you compare the trends of non-communicable diseases and infectious diseases, you can see the trend of non-communicable diseases has been progressively increasing over decades, whereas the trend of infectious diseases are somehow declining. I mean, the burden is kind of declining of infectious diseases. And the reason behind the drop of the infectious disease burden is due to the global efforts that has been put in place. Development of new medicines, development of vaccines, development of new protection mechanisms. If we say about malaria, so bednets has been made and have been widely distributed. If you say about HIV, condoms has been made and distributed. So you understand those global efforts has led to the decline of infectious diseases. But NCDs are just increasing due to the sedentary lifestyle that people are admitting, or that people are copying from some states or some other countries. Maybe you can imitate to eat the junky foods, the burgers and the other stuffs, just because you think they are fancy, just because you think they are for the people with a very good wallet. But you don't know something. You don't know that you're actually increasing, you're just accumulating. Or someone told me, if you eat ifiriti or if you eat those junky foods, you're just digging your hair with your own fork. Uri gucukura imva ukoresheje crochet. So the people are just admitting some new sedentary lifestyles, new practices which are not healthy, just because they think that practice is practiced by other people who have got a very good life, which is not good. So they're not admitting the practice just because they think it is something which is worthy to be done, or maybe which is benefiting their health. And something very interesting is this. If we say about, let's take one example of hypertension. Hypertension, one of the main risk factors is salt intake, which is high, which is not limited physical activity, smoking, and even alcohol. So those are very simple and minor things that can be simply adjusted. And finally, you do not control it. You finally get a high BP. A high BP is not painful, and at the end, it will give you stroke. And if it gives you a stroke, there is no reversal mechanism of that. So you've got stroke already. So, and currently, you know, stroke is killing many people in Rwanda, not in Rwanda, but globally. So Eric told us a lot about the policy stage, but we also have to think on the community level. So if we do see a rising trend of non-communicable diseases, if we see a rising trend of mortality and comorbidities that are being caused by non-communicable diseases, so that's a hot headache. That's a hot spot that we think that we should be thinking of addressing, not just thinking of only on the policy. The policy is okay and it's very good. If we do not have good policies, nothing is gonna go through. but we as people, as individuals here, so we also have to think, how can we make sure that the communities that we live in can just think or simply adhere to those practices, which are very minor, very simple, and that can give very good outputs, that can give a high yield in controlling the NCD. So we do not have to think simply on the policy level. Let's think on even our individual level on what we can do. We can create campaigns, we can do screenings, we can do awareness, we can do education, we can do posters, we can do social media, we can do very many different strategies that can be used. So we do not have to think of the other people, we also have to think about us, ourselves, what we can do, and not focus on infectious diseases or antimicrobial resistance because you think it is what Emil is doing. But think of the need and even your passion. So is there a need in antimicrobial resistance, or is there a need in non-communicable diseases? So then finally, me personally, am I interested in this field or this one? Or maybe Vivian chose to go to the...
Do you try to wrap up because we are already over time? It's good that you summarize quickly.
Yes, thank you very much. So it's very good to think about the need, and then you also think about even your will, what you want to do. Like for me, I was actively looking what I can do. After that, I realized that clinic is not something that I should be investing in my effort. So I tried to search, I tried to connect to people. One people introduced me to antimicrobial resistance. And then after that, I realized that even you can be affected, the surgery can be affected by antimicrobial resistance. So I started realizing that it's something which is very deep, which deserves attention. So thank you very much. I think we also have many other questions. Thank you.
Awesome.
Thank you so much.
I don't know if Mignon is going to give me a minute. My device disappointed me a bit, or I disappointed the device. I know we ran out of the time. I'm happy that Emil continued on what I started about the choice. No one is going to have kiosk for condom for NCDs. It's you to choose. You know what is healthy and what is not healthy. Back on the topic of bridging your career to the needs on the global health. One thing I want to add. I want to add one thing. You have to be present. What I mean by being present, you have to be present, you have to lead, you have to be in a meeting and you're in a meeting so that you know where to channel your effort. Because when we are still young, we are very ambitious and we scatter our energy. And I guess that can be my last recommendation: to be present, to be on time, and communicate what you want to do in life to the people who did it before you. Thank you very much, Mignon. Thank you, everyone.
Thank you so much, Vivian. Thank you, Emil. Thank you, Eric. Allow me to thank the presenters and panelists for the openness and very good insights we had today. Thank you so much, audience, for your patience. I know time is not on our side, but we do much better next time. And do not miss webinar 3. Do not miss it. All right. Thank you so much, everyone, for your presence and your attention. And see you all next Tuesday. Eric, over to you if there is any more communication, and then we say goodbye.
Nothing much. Thank you, everyone. Thank you, Emil and Vivian, for really sharing insightful conversation with us. I learned so much from your work and what you're doing. And probably I should invite you, Vivian, next time, because we're talking about career path. Please be on the call. Yeah.
Sure.
Thank you, and others who wrote comments. I hope next time.
A lot of people commented in the chat box. Please keep checking in the chat box. People are giving very good ideas. So thank you so much, everyone. See you next Tuesday. Bye-bye.
Thank you. Thank you.